Hi, I'm going to discuss about mood disorders. So, mood, which is an internal emotional state of an individual, how we feel. Mood disorders, also called as affective disorders, affect nothing but feeling. Let's see the definition of mood disorder. Mood is normally fluctuate between mild depression to mild elevation depending upon the circumstance. So always the mood will be changing in every person, changes. So according to the situations or circumstances, how they are going through the situation. But when the mood swings excessive in severity and in duration, and when it is interfering with a person's day to day activities, then it becomes mood disorder. It is very simple. Everyone, every person, every individual mood is normally fluctuate. Sometimes they cry, sometimes according to the situation they laugh. It depends upon the environment, how they are living in that. So it depends upon the circumstances. But the mood which swings excessively in severity and in duration, then it is called as a mood disorder. Let's see the classification of these mood disorder. Major depression, bipolar disorder, and dysthymic disorder. So when we see depression, every person universally they go through depression. When we see depression as a disorder, here we are going to discuss about depression as a disorder, which is also called as endogenous depression. And these mood disorders have three types: major depression, bipolar, and dysthymic. Let's see what is depression as a disorder. If depression is prolonged and interferes with day to day activities, condition is abnormal. See, if you are feeling very sad, depressive, someone has, there is a object loss or loss of loved one, so we'll come back from the depression after few days or few hours or few weeks. But it is prolonging and interfering with day to day activities. We cannot able to work, we cannot able to concentrate, we will be not mingling with anyone, so that activities are abnormal. It affects many people, and females suffer more than the males. In India, among elderly people will be having 13 to 22% above 60 years of age. So after 60 years of age, the old people, they feel like empty nest syndrome they go through. When they feel alone, all the children who has become adult and settled in their lives, so the old age people mostly affect this depression. And common age group for the depression is 30 to 50 years of age. Let's see what are all the causes for this depression. So if the mood is very depressive, like severe, creates a problem to the individual. So if it is prolonging due to loss of loved one or any financial loss, failure to achieve goals, separation, object loss, so this might be the causes for the depression, and many more. Let's see the clinical features, how these people will feel who are in a depression. There are 3 points, 3 symptoms: depressed mood, loss of interest, and from these 7 points, if 4 or more symptoms are present, the person is suffering with major depression. First one is feeling of worthlessness or guilt, impaired concentration, thoughts of suicide, loss of energy and fatigue, loss or increased appetite, in decreased or increased appetite, insomnia or excessive sleep, retardation or agitation, which is lack of interest. So these are the symptoms. If it is occurring for a prolonged period, so any four of them, any four from following 7 points, so the person is suffering with this depression. Let's see next, bipolar disorder or manic depressive psychosis. So before going to the manic depressive psychosis, we should know what is mania. Mania is nothing but euphoria, when extreme euphoria is there. Euphoria means intense excitement, overreaction. Here there is a marked increase in activity with excessive planning, marked increase in sociability even with previously unknown people, and they will be having poor judgment, often involved in high risk activities like reckless driving, distributing money to strangers, behaving weirdly, and usually dressed up in a gaudy and flamboyant cloth. So this is about mania. So manic depressive psychosis, when the person is going through mania plus as well as depression. So what this depressed mood? If there is a sadness of mood or loss of interest or lack of pleasure in almost in all activities, they are not at all interested, and these people the depression present throughout the day, varies from day to day and often unresponsive to the environment stimuli, result in social withdrawal and decreased ability to function in occupational and interpersonal areas, and decreased involvement in previously pleasurable activities. In complete severe depression, complete anhedonia, that means inability to experience pleasure. So there is a mania, there is a depressed mood. So their bipolar disorder can be unipolar also. In this condition, what happens? The person will suffer with only mania, that is unipolar, or only depression, major depression. So both bipolar. So let's see what is this bipolar. This is characterized by the recurrent episodes of mania and depression in the same patient at a different times. So if it is only excitement or mania, that is unipolar. So here recurrent episodes of mania and depression, that is bipolar disorder. Let's see the etiology of this bipolar disorder. Biological factors. So biological factors is nothing but genetical factors, biochemical changes, if there is any amines involvement, or norepinephrine, serotonin and dopamine. So if these levels are reduced in these patients as an error of metabolism, so due to that transposition of sodium and potassium will occur. So under biological there is a genetical and biochemical changes. Next is the psychological factors. It's nothing like feeling low self esteem, guilt, lack of support system, lack of clear goals, feeling of failure, inability to fulfill expectations. So as a response to suppression or object loss, or cognitive, like a narrow negative attitude about self, environment or future, bad or inadequate judgment. They feel always low, I can't do this, I cannot able to achieve my goals, the future might be bad for me, something is going to happen. So feeling of inferiority all the time. And behavioral like causes like hopelessness, loss of positive reinforcement. So definitely this is going to affect and may cause this bipolar disorders. And socio-cultural factors. Coming to the socio-cultural factors, social situation that brings feeling of powerlessness. Somebody is authorizing, like authority giving like superiority to us, and they always control us, so that may feel in the person powerlessness and low self esteem. And mostly when we talk about socio cultural factors, there may be a status of minority group, status of women, like male dominated occupation, role loss like emptiness syndrome as I said, and also injustice, poverty, unemployment. This all comes under socio cultural factors. Alcohol and drug abuse finally. So there is a strong relationship between alcohol, drug abuse and depression. So whenever the person is feeling depressive, especially males, they go for alcohol and also drug abuse. Whenever the person is feeling sad, either it is male or female, so they approach for alcohol. So if it is if they are habituated to take the alcohol and also abused drug abuse, this may cause this bipolar disorders. Clinical features of bipolar disorder, as I said, there will be a mania and depression. So characterized by recurrent at least 2 depressive episodes, that is unipolar. The current episodes in recurrent depressive disorder is specified like mild, moderate, severe without psychotic symptoms, severe with psychotic symptoms. It is nothing but there is with psychotic symptoms means there are hallucinations, illusions, but severe without psychotic, there will not be a hallucinations and illusions. Let us see the physical symptoms here. So multiple physical symptoms can be seen, aches and pain without any illness. They complain about pains and complain of reduced energy and easy fatigability. So that is about the bipolar disorder. We have seen major depression and bipolar disorder. Let us see the dysthymic disorder. So it is the condition where the depressive mood is present throughout the day for at least 2 years. So following symptoms, in this following 6 symptoms, if there are any 2 present for 2 years, that means the person is suffering with dysthymic disorder. Decreased or increased appetite, decreased or increased sleep, low energy or fatigue, low self-esteem, poor concentration or indecisiveness, that means not able to make the decisions, and feeling of hopelessness without any evidence of major depressions. If the person is suffering any 2, low energy and fatigue or low self-esteem for at least 2 years, so this may cause this dysthymic disorder. Let us see the management. Medical management. So here tricyclic antidepressants, imipropine in severe cases 75 to 150 mg or up to 300 mg can be given. Amitriptyline is not used due to dry mouth and blurry vision post hypertension due to the side effects of that. And there are newer antidepressants like fluoxetine, sertraline and citalopram. Serotonin like venlafaxine, duloxetine and mirtazapine. Lithium. Lithium is a drug of choice for the mania. It is an effective drug for the mania. 900 to 1500 mg of lithium carbonate per day it will be given. Mostly it is for the prevention of the episodes of bipolar disorder and need to be closely monitored by repeated blood levels. After giving this medication, the patient should be watched closely as the difference between the therapeutic and lethal blood level is not very wide. And antipsychotic drugs like commonly used drug rasperidone, olanzapine, clonazepam, quetiapine, haloperidol, aripiprazole, and other mood stabilizers like sodium valproate, carbamazepine, benzodiazepine, lamotrigine, and T3 and T4 as an adjunct will be given. And apart from this, electroconvulsive therapy will be given. This is a shock treatment. Electrodes are placed at temporal region. In next class, we will be discussing about electroconvulsive therapy. So here I am briefly I am explaining. So here what are all the indication when it's not necessary we should give all who are suffering with major depression or who are suffering with bipolar disorder. It's not necessary. When it becomes severe, then we should go for the electroconvulsive therapy, that is that should be prescribed by the only doctors. So here severe depression with suicidal risk, severe depression with stupor, severe psychomotor retardation or somatic syndrome, for those people can go for this ECT. And severe treatment refractory depression, delusional depression, significant antidepressant side effects. So for these people we have to go for the electroconvulsive therapy. In most clinical conditions, usually 6 to 8 times of electroconvulsive therapy are needed and it given 3 times a week. See, apart from medical management, in that physical, that is ECT, drug treatment and psychosocial treatment, which are psychotherapies, that should be given to the patient. Cognitive behavioral therapy and interpersonal therapy, psychoanalytical psychotherapy, behavioral therapy, group therapy and family and marital therapy should be given. So psychotherapies will be having a special class for that. So these are the therapies which should be given for the patient who are suffering with the mood disorder. And finally, nursing management. So there will be insomnia for the patient. So promote sleep and food intake, assess for suicidal risk or suicidal ideas. So diminish the feeling of loneliness by therapeutic communication and provide safe environment and reassure the patient, develop trusting relationship, use firm, kind and warm attitude, develop a trusting relationship with the patient and discourage sleep during the day. Use measure to promote sleep in the night and encourage the client to participate in occupational activities, like encourage or assist the patient to maintain good physical appearances by taking proper hygienic measure. So this is about the nursing management of mood disorders. So let's just briefly summarize about mood disorder. So mood disorder is normally mood is fluctuated between mild depression to mild elevation depending upon the circumstances, but when the mood is swing is present in excessively in severity, then it will be termed as mood disorder. So it is classified into 3: major depression, bipolar disorder and dysthymic. So what is major depression? When we see as a disorder, if it is prolonged and interferes with the day to day activities, then it is a depression, major depression. And manic depressive psychosis, which is bipolar disorder, where is a mania and depressive episodes can be seen. Mania is nothing but it is a extreme euphoria or intense excitement. And dysthymic disorder, in this condition depressive mood is present throughout the day for at least 2 years. So this is about the mood disorders and its management, causes and etiology. Hope you have understood. If you have any doubts, please message. Thank you.